Hi, I'm Jennifer with Sublimely Aligned, and today we're going to rotate for the alignment teaser. I'm actually in between child drop-off and child pickup, so I'm in my pants and t-shirt just getting some errands done, but it's appropriate because this is kind of the reality of most of us. We're trying to get things done as well as stay healthy, so there is always time to rotate, which is nice, and all you need is to find a comfortable place to sit. Rotation can happen standing, absolutely. You'll probably be able to translate this to a standing rotation potentially. And then there's also a great supine or lying down version, but that can be for another time. So all you need to do is find a place to sit. If you're going to sit on the floor, you might want to bolster yourself up. You just want to make sure you're not creating any tension anywhere else in the body as you rotate through the trunk. The reason why rotation is so important is a couple things I would say. One of them is my anecdotal experience, but it's hundreds of people coming through. As we get older, we just don't tend to rotate that much. And so we can't, our tissues get stickier, our muscles sort of don't yield in the same way, and then that sort of perpetuates itself, and suddenly the rotation or the yield isn't there through the trunk, and it's very vital. We have all our systems, organs, processes contained in our trunk, and so it's important to keep that. It's a little bit of movement, but it's important movement. And the second reason is because from what I've seen, and again, this is just my experience, is rotation, if it's happening, seems to happen in one way, and it seems to be a little more posterior in the back. So this is just going to give you another way to rotate, different loads to the system. You can also continue to do the sort of more prevalent rotation, but if you try this one out, you'll notice it's kind of neat. It just sort of awakens the abdominal muscles. It's sort of, I'll let you try, and you can decide, but it's just different. So different loads to the tissues, more variety. That's what we're going for, right? So let's just get started. I am going to sit, I'm bolstered up a little bit, so I don't have any tension in the front of my hips or my low back. And I'm going to sit in a V-sit for a little bit of a stretch in my inner thighs while I do this. Yeah, and then we're going to work with the rib cage and the pelvis. So basically, you can rotate the pelvis relative to the rib cage. And that would be, I should have thought this through, but that might be a lying one, for example. It wouldn't be sitting. And then today we're going to rotate the rib cage, which starts just above the clavicle and goes, you sort of have to find where it goes. It's sort of poking around to find your lowest rib. And we're going to rotate the rib cage relative to a still pelvis. So go ahead and find your comfortable seated position. You want to have your pelvis in neutral. So that's finding the bony protuberances, the ASIS, and they should be stacked directly above the pubic symphysis. So you can sort of take a peek at the blog for more information on neutral pelvis if you don't have that, but for today, that's sort of the markers. The other thing is nice, if you have something firm that you're sitting on, it doesn't happen as well with a pillow, but you can absolutely certainly bolster on a pillow. But if you're sitting on something with a firm surface, you can feel those sit bones at the bottom of the pelvis. And that's a nice way just to check in that you are sitting on the sit bones as versus the sacrum. And you're going to also notice the sort of distribution of weight. So you want to kind of keep it even. Often when we rotate, as we rotate, we lift one sit bone. So it's nice if you do have something firm to sit on. That's why an office chair or a kitchen table chair can work great too. So we're going to find a neutral pelvis, and I realize this isn't the best outfit for it, but this is, what I'm wearing, this is what I'm doing, and it works fine in terms of rotation. And then we're going to keep our pelvis still and in neutral, and we're going to get the ribs in neutral. So this is the key piece. You're going to find your bottom rib, and you're going to just sort of let the back relax so the rib comes down, the ribs come down towards the pelvis, and back in space a little bit. You're essentially stacking your rib cage over your pelvis for a neutral rib cage. And you're going to keep this, and then without using any sort of hand or muscle, you're just going to rotate to one side. You want to maintain the same length through both sides. In other words, you can keep that rotation and breathe there, but in other words, as you rotate, you don't want to side bend. So you want to feel like the distance from the hip to the underarm is the same as you rotate through. And then you're going to breathe there, take a couple breaths there, and notice how the breathing in rotation is a little, it produces some stretch perhaps, It's a little harder because the muscles are engaged a little bit more. And then you can go ahead and come back to center. And you can rotate with different muscles. So you're gonna just reset the rib cage in case you're someone who likes to lift their chest from habit, which someone like I do that often, so kind of reset. Notice how when you do the neutral rib cage, I don't wanna get too far off track, but you may already feel tone in the abdomen without doing anything else. Then trying to keep the length of both sides the same as you rotate. Just go as far as your tissues permit. At this point, you don't need to do any more than this. And you can picture, if you want, this back side of the body, so the back pushing for the rotation, as well as sort of the front pulling. Breathing here and come back. So this differs from what I've seen more predominantly in a rotation where the instruction is to sort of lift the chest and rotate. And it's worth it to try both versions just to see the comparison. Because if you're someone that has been doing the lift and rotate, then you're really going to benefit from the different variety. The other thing you should notice when you lift and rotate, you might notice you feel it through the back more. Again, everyone's different. But with this one, you really should feel the engagement of the trunk muscles, particularly the anterior ones, so the abdominals really. You should feel more work there, which is great. You can use your breath as usual. So on the moving, you can exhale gently through the lips just a little bit. Tends to facilitate the transversus coming on. So it doesn't have to be heavy. It's not the traditional Pilates breath. It can just be a little bit. So give it a try. This is something certainly you can weave throughout your day in an office pretty discreetly. If you're a teacher, when you're sitting at the desk, you can rotate to address kids. If you're at home quite a bit, you can do it in your chair. Or if you get a chance to get down on the floor, bolstered up, it's a nice opportunity to get a little different geometry in at the hips. So give it a try and enjoy. Let me know how it goes.